we've built we've built this expectation up in the students about what feedback should look like. And it's often when you hear, when you survey students, they often say, well, I didn't get any feedback. They're used to actually hearing and seeing this model. So again, we really encourage you to label your feedback. Joe jokingly says using the F word. It's the only F word you're allowed to use, feedback. And it really is critical because we really try to structure this both undergraduate and small group, obviously in the phase 2 elective clerkships, and of course in the electives as well. And I think it's really also critical to make certain that we emphasize that written narrative formative feedback as well as verbal feedback is really, really critical. Again, this is where everyone lives that's giving electives in the latter part of the phase 2 of the curriculum. And in phase 3, our medical school's built on phases. Phase 1 is 16 months of basic science and some clinical work. Phase 2 is a fairly traditional clerkship year, followed by advanced clinical rotations and various electives, along with their step 1 and step 2 boards. And then phase 3, the traditional 4th year, is filled with a series of electives, which is where we live. And again, it's really absolutely critical to reinforce, in all of our students, whether it's a clinical rotation or a non-clinical rotation, to really look towards feedback as a way to continue to build their skills. Actually, we preach this to the residents and to the faculty as well. We should all be students looking for growth goals. And actually, we would actually suggest you think about this yourself as faculty. What should be your growth goals and plan for growing as you go? Obviously, you're here, so one of your growth goals is to learn better feedback, which is fantastic. But I think we all should think of ourselves as students as well as faculty. And again, we should be asking for feedback as well. And actually, I think that's one of the strengths of our model is that it emphasizes that feedback is a conversation. It's not one way. We don't give feedback. It really should be a feedback discussion, and that implies that the arrow goes in both directions. And it really is critical, obviously, and although you're formally required to give midpoint feedback in all electives that are 4 weeks, the reality is that really we should be giving feedback on a pretty regular basis. And again, that feedback should be a conversation, clearly in both directions.
If I could just jump in here, Dr. G, just that we've always had a feedback form, inter-rater feedback form that faculty or leads can complete to help with giving that feedback. It's a place to jot down notes and feedback that you want the students to receive, that you could either use for your verbal feedback or to one of the things we are finding that's helpful in the clerkships as well is that these feedback forms can be completed by faculty that teach in the electives, and that can be passed on then to the leads for assessment, using some of that for more formal feedback at the end and assessment. So the narrative pieces. So just to keep that in mind, and we'll send out those forms again to everyone just so you have them available. But just that's been helpful, and we're trying to really work closely with clerkships and the sub-Is and others to get some of these best practices that are helpful for everyone to just make it a little bit easier in implementing everything. Okay, that's pretty much all I wanted to say. I think the others are going to do the rest, but.
Back up for just a second. Actually, interestingly enough, this picture is in here because it reminds me, the feedback is obviously about knowledge, presentations, all the EPAs, but it also can be procedural. Like, for example, in this picture you see, this is a neonatal resuscitation, and they're using a outmoded anesthesia bag, which should never be used ever. So if I was giving feedback to the people doing this resuscitation, I would respectfully suggest that they got to take that anesthesia bag and go put it someplace in the closet and not be using it. Next slide. So why don't we go on, take us off share screen and just go to gallery view real quickly. So I'd love to hear from everyone real quickly, and everyone can just sort of jump in about, how you've been using feedback and what kind of barriers you've run into in your experience with students, residents, and faculty. Hannah, you're probably the most experienced person here, I would imagine, in terms of running your.
I don't know about that, but I'm happy to jump in. Okay, feedback. So I haven't rounded with medical students in a clinical setting in a while. My approach when I did do that was um, to build on a lot of informal feedback, and then a lot of that is relationship building. I found to like be a trusted person, right? So that you're have so that you can know what the students don't know, right? Like there has to be an opportunity to get inside a student's thought process to be able to, at least for the things I was teaching, I wasn't teaching procedures and things like that at this time. But what strikes me about the building to the midway formative and then the feedback is that it is built on data. And in order to have that data about students' thought processes, you have to create those opportunities for them to share and to be a person that they feel comfortable making a mistake in front of, quote unquote, so that you can say, this is like how you need to think about this. In the clerkship, I have a more formal approach. And there are more faculty teaching the students. We have all of our directors of bioethics are involved in teaching the students, and Charles Binkley also does some AI ethics with them, but primarily it falls to me and the directors. And actually, I don't know how they're giving their informal feedback when the students are rounding. I can talk with them about that. I take on the midway feedback and primarily base it on the sessions in the elective, which used to be a lot more being like teaching the students, but in the last iteration of the elective, we changed our format to giving them readings and cases and things to understand, and then a discussion guide. This was help with Beth, a discussion guide, and then I observe their conversation going through the questions that the discussion guide has. So they're wrestling with, ethics case questions and analysis and stuff. And then the real cornerstone of the midway formative feedback is they do two case write-ups where they have to formally write up an ethics case analysis. And then I teach them from there. And then their summative feedback, their summative grade stuff is a formal presentation. But that's it. The hardest feedback I have to give is to my faculty.
But that's a great point, because this actual workshop is not just for you to students. It's really, theoretically, it should be to house staff and to each other, to our attendings. I mean, sometimes the attendings who already have a pattern established are the hardest people to really help learn. Christina, have you had much experience with feedback with the students and/or residents?
Not with the students, but with our fellows, absolutely. And I think there are a lot of challenges, but I actually agree. I think that having the faculty, number one, getting faculties to submit their feedback, and having them, number one, submit feedback that's sort of specific and actionable, and all of those things, those components of kind of high quality feedback that we talk about, and then also aligning what faculty expectations are. So.
Now, we're done with the workshop. You've raised all the major issues. Let's go back to the slides. Next slide. And again, who's next? Joe, you jumping in now? Yep.
Correct. All right. So we've kind of discussed a little bit about the importance of learning objectives earlier. We're going to move into that last part of that triple trump of good education design. So goal assessment, we're moving into the feedback and that action plan to kind of go through and discuss how we get our information that we need to provide our learner and get them to progress to the next step. So when we go to do a feedback conversation, it's really important we do a little bit of homework beforehand. We need to prepare for that. And that's why this acronym PREPS is really important, right? So we need to be able to promote a relationship and establish goals. Matt, if you press the next button, it should pop up. Yep. That needs to be done up front. So when the learner comes in, you're working with them, whether for the entire elective or just that day. We need to find some way to develop a relationship with them, and then also establish the goals for either that overall elective or just that day that you're working with them. And that can be as simple as going through the 1 minute learner to try and establish the goals for that session. And then immediately prior to having that feedback conversation, you want to pick a setting. Pick a setting that's going to be appropriate for the type of feedback you're giving. If it's difficult feedback, you may want to pick somewhere that is quiet, somewhere a little bit more private, somewhere where they feel like there may not be people watching. So that way you're able to handle any emotional responses that occur. You may want to pick somewhere nice where you can sit down and more comfortable for that. And then lastly, you should signpost. And we say signpost, like Dr. Giuliano said, I like to joke and say this is the F word that you should be using in the work environment, and that is feedback. So making sure that it's explicit that we're going to be having a feedback conversation. That way the learner knows that you're about to have some sort of transmission information to them that they are going to want to take actions on to get better. So signposting is really important. It'll help with your evaluations when learners say, oh, I never received feedback on my elective. If you make sure you're being explicit and saying we're having a feedback conversation, it kind of reduces that. Also, we oftentimes go to give feedback, but we don't recognize that it's a feedback conversation. So making sure that we're signpost really makes it explicit that we're doing that. This slide really goes through ways that we can quickly foster that relationship, because you may only be working with that student for a short amount of time. It's always important to really engage them as a person, get to know them, their interests, their backgrounds. One of the easiest ways to do this is to get to know their name, get to know the proper pronunciation of their name, and use that name when you're talking with them. Oftentimes we kind of skip right past that and then we just go right into, okay, we're just going to engage in this conversation, but we don't use their name. It's a quick way to build that relationship. Understand their context. So again, we go back to that 1 minute learner model. Find out their prior knowledge, what they've done, where they come from, their prior experiences before your elective. It will really go a long way in terms of fostering that relationship in a quick, meaningful way. So the model we propose that you use to have your feedback conversations with your students is the Forward with Feedback model. This model, as you see as we go through this, is a really great model at developing the relationship and bringing different perspectives. This model was developed by a working group at the School of Medicine, and it may be based off other models you're familiar with, such as the R2C2 model. This model really takes it a step further where it brings the goal part to the front of the conversation. And I love this graphic because as you see here, it shows feedback isn't just a conversation we have and it ends, but it's rather a process for continuous improvement and development. It's a circle, it keeps going. You hit that coaching plan and it brings it into your next feedback conversation. It also highlights that there is a relationship. It's not a one-way transmission. If you fall into the trap I fall into sometimes is I'm going to give feedback, or Meta, who's on my call, Meta, I'd like to give you feedback. That implies a one-way relationship, right? So rather we want to start changing the language of, I want to have a feedback conversation with you. Feedback should be a conversational approach. That way you're able to bring the student's perspective, their understanding into the conversation. It's not just one way. So our first step of this model is to identify the goal. And this simply is stating what their goal or target was and bringing it to the front of the mind to guide the conversation. If you're working with your learners, you should have them reflect back to their goal. Every day they're coming into your environment, there should be some sort of goal we're working on. It could be the overall goals of your elective that come up, but as long as there's some skill that we're going to structure our feedback conversation around, we want to make sure we're bringing that back up to the front of the conversation here to start the process. After we identify, we discuss that goal, simply saying, well, what was your goal for that encounter? We then go to the self-assessment step. And this is the phase where it's entirely critical, where you ask about their performance. Ask them, what did they think went well? What did they think they struggled with? Explore their thoughts, explore their reactions, ask follow-up questions here. This is critical. Why? because we want to develop learners who are self-directed. Oftentimes when we go through and we ask them to do this self-assessment, you may find that they are overly critical, or they may be unaware of their current skill. By going through doing the self-assessment, we are actually calibrating that learner now to be able to identify their own performance, where they're at. So when they encounter times where they may not be receiving feedback on a regular basis, they're able to self-identify areas for improvement and how to get there. So we're teaching them those skills in this feedback conversation. After we do that self-assessment, we hit the gaps and the strengths. Now, again, this is where you come through and you're going to state what you saw that learner do well, and then what you saw that they need to make improvements on. This shouldn't simply be you going through and stating out a list of everything they've done well or everything that they need to make improvements, but we want to prioritize it, right? So we want to go through, we want to triage, all right, what's the most important thing for this learner based on this discussion that they need to go immediately make improvements on to progress in their trajectory? We want to narrow that down. If we give them that whole laundry list of items to get better, they may focus on a one or two, and it may not be the most important for their development. The other thing you want to do here, state what you observed. Explore what you observed. The reason for that, if we go through and we say, oh, okay, well, they did this. This is probably why they asked their questions or phrased it like this. This is probably why they did this. What happens is we're making assumptions, and we really want to explore the student. Well, I noticed you were looking at your paper a lot while taking that history from that patient. What was the reason for that? Now we have a better idea to understand their thought process, where they're coming from, and really tailor our coaching plan and our feedback to that learner. It allows them to start playing with those ideas and bring it to the forefront of their mind. The other thing that we need to do here is I always think we need to close it with a summary statement with the gaps and strengths. Check to make sure that they're understanding what you're saying. Check to see how they're reacting with what you're saying and providing feedback. That really will help you understand, are you getting your point across? We think we're delivering a message. We think that they're understanding it. But if we don't ask for that information, they may not be really taking it in, that feedback, in the way that we mean. You may have to revisit the approach. After we go through that, we come up with a coaching plan. I always like to start off with the coaching plan of, well, based on this feedback, what are some steps you can do to make an improvement next time you come in here? The reason for that is they're now taking ownership over the actions that they're going to follow up on for that coaching plan. And then what you'll need to do is come in and be able to provide input, maybe give them some guidance, and provide resources for support for them to follow up on that action plan. And don't just leave it there. Make sure there is a plan for follow-up. You may not be working with that student again the next day. Maybe you want to say, all right, when you come in tomorrow, whoever you're working with, let them know this is what you want feedback on. This is what you're working towards. So that way we're making sure that they're taking that feedback you're giving them, and they're making a plan and taking actions on that. Oftentimes we give feedback, we tell them to go through and do make a change, but we don't follow up on it, and that feedback gets left at the door as they leave, they go home, they forget. Making sure we're following up on it is critical at driving them to make those changes and go to the next level. So as we discussed here, the more detailed when you go to give your feedback, basing it on your observations, the better. Oftentimes that really requires you to have a piece of paper or have your phone open and take notes on what you're observing. That will help you be detailed and state exactly what you saw, and allow the student to have a deeper understanding of the actions they're doing to get that feedback. We want to leave that good job or they're doing well on this elective, leave that at the door. It doesn't make a difference. Yes, the student will feel good. Oh, great. Everyone loves praise. But it doesn't help them progress to deepen their skills. There's always some sort of thing we can try and find to get better, to make improvements, no matter what level we're at. We want to show that growth-oriented mindset to our students and give them feedback they'll be able to get better on. Same with those examples of unhelpful feedback. Read more. What should they be reading? What should they be looking at? What resources should they be utilizing to read more? You will make a great doctor one day. Well, what do I have to do to become that great doctor? Let's provide those details and really help them get to there. So I just talked through a model. And if you're like me, that's great. what we want to do is actually show you it being used. But before we do that, let's stop and ask any questions. Anyone have any questions about what we just presented and discussed before we see it being used and applied? All right. Meadow, do you mind?
Joe, what I have to actually, the picture you showed on building relationships, it's actually that picture. We didn't really comment on it, but there's so much there, that the leaning in, having a cup of coffee, obviously a safe, relaxed environment. It's, there's so much subtlety to all of that. That's all in that picture. You can clearly see that, that their people are engaged and really attentive to each other. I really love that picture you have.
Yes, no, definitely. All right. So we're going to watch this video. We're going to see someone applying the forwarded feedback model and having a feedback conversation with their learner. And then we'll discuss a little bit before we move into our activity.
Hey, Dr. Zacharatos. You got some time to talk?
Absolutely. It's been a long day.
It's been hectic for me. What about yourself?
A lot of cool pathology.
Oh.
But let's talk about Mr. Jenkins' encounter.
Yeah, I'd really appreciate it. I'd really like some feedback. Is that okay?
Yeah, let's start with, what are your goals for that encounter?
Yeah, I just really needed to get through that checklist. It's a broad differential, so really needed to ask a lot of questions and figure out what's going on and get out of there.
Okay. Well, I saw some really positive things, but I saw some things that we can improve upon. I wanted to ask your perspective. What were the things that you thought were really good that you did?
Yeah, I really liked hearing the conversation, hearing what brought him in. I thought I was able to get through that checklist of questions in a pretty quick way.
I agree with you. I think that you had some key points that you provided me, and you were able to express the conversation, and you gave me an idea of what was happening. But now, what were some of the things that you could have improved upon before I give you that?
I think it's really everything. I just don't think that I did really well. I'm not sure if I missed something. I could have missed something. I was confused between, was it a tension headache or a migraine? I wasn't sure.
Listen, we all have to start somewhere. So you just have to stay relaxed and don't try to over criticize yourself. You did some really good things that we can build upon the foundation and get you better for the next time. So you did a really good job. So I want you to take this feedback and let's look at it in different ways.
Thanks.
So from one positive, I think you were able to get him to open up and you made him feel comfortable. That's when I went in there. That's what he expressed to me. A couple things. I want you to use better eye contact. Even when you talk to patients and talk to your colleagues, look at them, because I think you're going to develop that confidence and trust, and immediately you're going to develop a rapport. Just like this, doing great.
Okay.
Okay. So
Didn't
that's
know
the
that.
number one.
Okay.
So once you do that eye contact, you break down a lot of the barriers. Am I explaining that okay?
Yeah.
Okay. So the second thing would be, when you have some of the key points of information, try to go into the who, what, where, and why. So you have that complete history. And then once you have that complete history, then it gives you an easier way to formulate a differential diagnosis.
Okay.
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 And then the next thing is, you saw that we had 17 patients today. Sometimes if we don't narrow this time, the day can last long, and my MAs leave and the front desk leaves and everyone gets upset. So what would you think, how could you improve upon the time management?
I'm not really sure. I thought that I could maybe just ask other residents or the nurses what this patient has been like overnight and just feel it out before going in there.
Okay. One thing I have learned over the years is to go and do my homework. I go into the chart, I look at the chief complaint, I look at the past notes, I look at some imaging. So I have a very focused plan in terms of why I think they're coming to see us. And that way I keep the conversation very pleasant, but then also focused on what they need me to address.
Okay. How long does that take you?
Well, sometimes it takes me like an hour before or 2 hours before to really hone in on the information so I can maximize that clinic visit for them. So a combination of the eye contact, making them feel comfortable, plus the time management will help them move forward and trust me. And in turn, this is what you're going to use as a resource for your future.
Okay, I'll think about that.
Awesome. So given what we talked about, I'd like you to utilize that in a dynamic way.
Okay.
What are you going to utilize for the next encounter? One thing that you're going to utilize, so that way you make it better for yourself. Because I want you to build on the steps, building a strong foundation.
Yeah, like we just spoke about, we can use Epic before going in, and I can do my homework before seeing the patient and really knowing where I'm going before getting into that room.
That's great. I really want you to not be too critical of yourself, but I want you to learn from every encounter that you do, because then you get stronger that way.
Okay. Thank you. Thank you. Hey, Dr. Zacharatos. You got some questions?
Great, thank you, Meta. So we all had a chance there to see this model being utilized. What are our thoughts? What did we observe while watching that? Feel free to either raise your hand or unmute or chat in.
One thing that struck out to me, that struck me was what he kept. I don't know how many times he came back to it, but it stood out to me that the instructor said, "What I want for you, what I want for you," kind of in a very, mentoring, loving way. Like if I were that student, I would have been like, okay, this guy is on my side. Like I can trust his feedback.
That's a great point to highlight there. I think this preceptor, this doctor working with the student, does a great job at trying to build up that student and develop that relationship, showing that they're not alone. So they're showing that it takes both parties are involved. He's taking kind of guidance into their learning, which is helpful, right? So one thing I notice every time I watch this is that students' body language, the way they're talking, you can see that they're looking down, they're hard on themselves. He does a really good job at trying to pull out and make it a positive instead of, look, you did a really bad job at developing a relationship with this patient. Instead of focusing on that, they really try to spin it in a way, let's uplift, let's motivate you. This is a student who's probably struggling with that motivation to get better. And that's done very well there. Anything else?
Oh.
Yes, Dr. Chow.
Oh, sorry. I have two. So one is also that he does, he's constantly sort of asking the student first, how do you feel like, and sort of engaging and building on that. I do think, and I don't know if my judgment was too colored by Dr. Giuliano's comments about that other photograph, is just, the student does look like so obviously uncomfortable, and they're just sort of standing in this room, and the instructor is kind of like a little bit like sort of like I won't say pacing, but maybe that there's a way to move that into an environment that is a little more comfortable.
That is an excellent observation. That would be probably one of my only critiques if you go to watch that. The body language, it's very awkward, uncomfortable, right? So we're seeing them, they're standing there, he's bouncing a little bit, pacing back and forth, finding a spot that would be a little more comfortable, going to a room to sit down, an office, taking them, like Dr. John said, let's go grab a cup of coffee, moving them out of that exam room space may allow them to become more comfortable and open up, because it could be something in that setting that's like they're still feeling a little uncomfortable. So that's a great observation there. The other thing that you pointed out was how he was asking the student, exploring their thoughts and feelings. And that really is great, like we discussed, right? So we allow them to bring their perspective into it. The other thing it does is if you have a student who's very self-aware, it just made your job, if you're a little apprehensive on delivering feedback, way easier. Because now they're bringing it up, and I'm happy you brought that up. That's something I saw. And it kind of takes, if you have like a critical point you want to bring up, if they're aware of that, it makes it a lot easier on yourself from approaching the conversation. So that's why I love you have the student go first. It kind of makes it a little bit easier for yourself. All right. Meta, do you mind going to the next slide? And we're going to actually practice this. So we're going to watch a video, and I love that we have a small group here because it'll give everyone a chance to be involved and have to go to a breakout room. But what we're going to do is we're going to watch an encounter of a student taking a history from the patient. But what I want you to do is to take notes or try and remember how that student does at performing that history, and how they are at either expressing empathy, because that's going to be the focus of the feedback conversation we have. We're going to role play this. So we really want to focus, watch this, and see how the student takes that history, ask those questions, and how they are at the opportunities to develop empathy with that patient, express empathy. So what we're going to do is we're going to watch this video, and then we'll discuss how we're going to structure the role play.
Yeah.
Hi, is this the medical student?
Yep, it is.
Hi, this is Ashley from Triage. We have a patient to be evaluated. She's a 32-year-old G1P0. She's at 39 weeks and 2 days. She came in complaining of some leakage of fluid. Oh, and she's GBS positive.
Okay, I'll try to be there soon. Hi, I'm student Dr. Smith. What's going on?
I think I'm leaking fluid.
Okay. Any other complaints?
No, just the fluid.
What number pregnancy is this?
This is my first pregnancy.
Okay. Any medical problems?
I do have exercise-induced asthma.
Gotcha. Do you use any medication?
I have an inhaler, albuterol, but I honestly can't remember the last time I used it.
Sure. Any surgeries in the past?
I did have my tonsils out as a kid, but nothing recent.
Got it. Are you taking any other medications?
No,
Any allergies?
I am allergic to penicillin.
Okay. Do you use alcohol or drugs?
No.
Okay. I'm going to examine you now.
Okay.
Seems like you have no pain.
Yeah.
I'm looking at your vital signs. Your blood pressure looks normal, and everything else looks normal too.
Okay.
I'm also looking at your baby's heart rate. I think it looks normal, and it seems like you're having irregular contractions.
Okay.
So I'm going to get my resident physician who's working with me today, and we're going to do a pelvic exam to see what you're leaking.
Okay.
I'll be right back.
Okay.
All right. So what we're going to do is we're going to ask, we have 3 people participate, 1 play the observer. So that person's role will be to observe a feedback conversation between a learner and the faculty member, and then be prepared to give feedback, modeling the forward feedback model to the faculty member. The next person we'll ask to be is the learner. So put yourself in that learner's shoes and have a feedback conversation with the faculty member. And the last position will be the faculty member, the person who's going to have that feedback conversation. And we ask that you try and role play it with using the forward feedback model. So let's take a look. I think we just lost 1 participant. So I would ask that Dr. Cho and Dr. Lippman play one of the roles, and then either Dr. Giuliano or Meta, if you want to jump in and play one of the roles as well, it'd be great to round out the list.
Fine, that's fine with me. So the forward with feedback card is what was shared in the chat.
Yep, and then Meta's actually going to put the model up on the slide.
Okay. Just an FYI, it's shared as a Word document, and many of us who work at HMH don't have access to Microsoft Office. At least I don't. So I can download it and I can look at it, but I have to upload it and convert it to a Google Doc in order to be able to make any use of it. So I don't know if there's a way to make that easier.
You know what? I'm gonna, while we role play, I will make it a PDF.
Yeah, it is fine too. Okay. Good.
So I need someone to volunteer to be the student and someone to volunteer to be the faculty member and the observer.
I can be the student, or I have no preference to be honest.
All right, so Dr. Cho, you're going to play the student. Dr. Lippman, do you mind being the faculty member?
No, that's fine.
Perfect. And then Dr.
Why
Giuliano,
don't we give Dr. Cho the faculty member job?
Okay.
Okay.
Because that's obviously also the most active and important one. The student one's gonna, basically be probably pretty passive.
So then why don't we do this? Dr. Lippman, you'll be the observer. Dr. Cho, you'll be the faculty member. And Dr. Giuliano, I know you love acting. Would you mind being our student?
Yes. And what mindset should I have? Am I just ignorant and willing?
We are going to have you be unaware of your current skill set, but willing to make change. Yes.
Yeah, because I'm pretty unaware. All right, I'm good.
Are we
Yeah, so whenever you want to start the
Okay.
conversation, you're more than welcome.
all right. Hey, good morning.
Good morning. Man, did I mess up there? I'm so nervous.
Why don't we find a nice place to chat? If that's okay, do you have a moment?
Yeah, actually, I could go for a real drink right now. Go stop and go.
We've all been in your shoes, all right? So first, tell me how's the rotation going?
Pretty overwhelmed. I mean, it's obvious that I don't have much of a knowledge base around obstetrics. I'm more interested in doing internal medicine and just started the clerkship, and I think pretty obviously didn't really know what I should ask.
Oh, and how did that feel when you were talking to that patient today?
Um, I was very uncomfortable because I guess my own ignorance made me feel uncomfortable. I really didn't know what to ask, and I'm really uncomfortable around the physical exam. And to be perfectly honest, pregnancy makes me get really nervous in the first place.
Sorry, I'm a really bad actor, so I'm having trouble. So I'm gonna take a moment. So,
This isn't funny. I'm having a really hard
oh,
time.
sorry. I'm doing that.
I mean,
Oh no, I'm
I'm
feeling
up
more.
that bad. You're laughing at me. Oh no.
Sorry. I'm really sorry. Um, so, um, so first I can tell you, all of us have been in your shoes. I to this day, there are times when it's easy for us to get down on ourselves and feel like we didn't do enough or aren't enough for this big job. What are things you think would help you so that tomorrow you don't feel so uncomfortable?
Well, probably a good place to start would be to understand the differential for someone who presents with, leaking. And I just assumed, to be honest, that she just broke a water. I didn't even ask any questions for anything else. And if I didn't know the other possibilities, it's pretty hard to ask focused questions to try to rule them out. And I need to just spend more time getting comfortable interacting with patients, because when I don't know what I should be asking, it really makes me very uncomfortable.
Yes, of course. I mean, that's completely normal to feel uncomfortable in a situation like that. You mentioned, you're more interested in internal medicine. So do you feel that way on your medicine rotations?
In my medicine rotations, I was sort of always do a little bit of work beforehand when I knew what the symptom was, and would quickly generate a differential, and I felt a lot more comfortable when I knew, sort of, the 4, 5, 6 things that really mattered. I didn't know it, and I didn't do my homework beforehand, and ended up doing it in the history you saw, which I was very unhappy with.
So can you think of ways that you could work on bringing that those skills or that preparation to this rotation?
I need a little more knowledge to start with, and hopefully that will help me get more comfortable. Because to be honest, I wasn't working on any communication skills. I was sitting there thinking to myself, what else could this be? That was all my entire cognitive load went to that, instead of paying any attention to the patient. I felt like I practically ignored her.
Sure. And, at the end of the day, if you're worried that you don't have the medical knowledge to help that patient, it's hard to remember all of those things and to keep on top of those things. And that's why you're here and learning so that we can help you get better, and to feel better about your patient interactions. Are there specific, parts of OB/GYN where you feel especially, uncomfortable in terms of the medical knowledge?
Everything.
Um, what sources or sort of what structure are you using to construct your studying right now?
Um, to be honest, for obstetrics, I knew I had a ton of resources for internal medicine. I really just getting started, and I guess I need, that's one of the things I need is,
Mhm.
what's a good go-to resource that can help me generate differentials and sort of help me get the basics down so that I don't feel so uncomfortable. Maybe that's
Uh,
something you can help me with.
Absolutely, absolutely. Um, and you know, I am sorry. Sorry, everybody. We can, so I can absolutely provide that for you. Are there, is there a specific type of resource that I can provide that you find is usually the most helpful? Is it, do you, how do you, do you learn from books? Do you learn from websites?
Well, my go-to resource is Dynamed Plus, and I've started to use Open Evidence as a AI tool. Uh, but I just didn't, I hadn't started trying to use those, and I don't know whether there's something more appropriate for specifically for obstetrics.
So yeah, so we are happy to provide that for you, and to give you a scaffold to structure your learning so that you do feel more comfortable in your patient interactions.
That would help me a lot. I believe it or not, Dr. Chu, I actually have pretty good communication skills when I'm not so nervous and don't know things, but I hope I can demonstrate that with my next patient with a little more knowledge.
So in terms of your communication skills, what did you think went well today, and what
Nothing
didn't?
went well. I was horrible. I wasn't empathetic. This poor woman is probably scared to death. I didn't recognize. I mean, she clearly was nervous, and I didn't acknowledge that. I felt really, really bad about it.
Is there, are there specific moments during the conversation today that really stick out in your mind as a time when you would have done something differently?
Probably I started off badly and went downhill from there in the sense that I really wasn't very empathetic about how afraid she must be, acknowledge that. Um, I just went into a standard sort of checklist that I have in the back of my head that clearly I didn't build much. I don't think I built any rapport, and I really didn't acknowledge what she must be feeling. I think that was where things started off bad, and once you don't build that therapeutic relationship, I think it just got worse. I'm quite certain if you go ask her, she probably thinks I'm an idiot.
Um, I, you know, I hear that you're, really beating yourself up about this. And this is one patient encounter, and you're here to learn, and we will help you, with the medical knowledge that, it sounds like you have your own system, and we can help you apply that system to this rotation so that you do feel more comfortable. I can also hear that you sort of know, what, the type of communication and report that you want to have, and we can also help you with that, and and let you overall feel more comfortable during these interactions.
Yeah, that sounds like a really good plan. Can I stay with you? Because you make me feel a lot more comfortable than I have
Well,
up till now.
Well, I do absolutely want to loop back around in the coming days, and make sure that that you're feeling okay, and just to kind of check in to see how you're doing, because this is really an overwhelming rotation. It's overwhelming rotation for all of us. I remember very clearly my experience as a med student on my OB-GYN
Perfect.
rotation.
I'm gonna stop us here for time, but I love the follow-up that you're developing right there. We threw
I'm
you to the wolves there.
sorry.
Dr. Giuliano is a struggling actor. He really wishes he became an actor, I think. He does a great job with it and really gets into character. So
Joe, I am an actor.
you are an actor, correct? So, but let's debrief. I want to allow Dr. Lippman to jump in and, as the observer, discuss it.
First, I'll ask the person in the hot seat. I always debrief the person in the hot seat first. What was your experience? What went well? What would you improve on?
I so I have to say, number one, like, these types of like simulated things are like a particular weakness of mine. You can probably tell I like get very very nervous. I think honestly part of it was that there were so many different things that and I think this happens a lot, to that one could comment on in terms of the patient interaction. Um and when the student, and this is how, when you ask a learner sort of what do you think went well and went wrong, they usually are not like, okay, it's 1, 2, 3, it is this sort of like a jumble of it's all that, and then getting them to that point where it's like, here are a couple of actionable things. It's obviously much more, I personally think, more difficult when there are a lot of deficiencies as opposed to, a situation where there are kind of 1 or 2 things that you can provide feedback on. I think also, the student obviously, is really down on themselves and having a hard time. I noticed in the interaction, like the very first thing, the beginning of the interaction is like someone calling them and just saying, hey, is this the medical student? Like that, obviously, this environment is not, not necessarily, one that is sort of ideally suited for their well-being. And it's hard. And I think the fact also personally that it's no beguine, for me also like that, I do remember that it's a high pressure rotation. And, so I think that kind of trying to get them on track while also providing the reassurance and not trying to guide the conversation too much to sort of the, where I would sort of see was the endpoint, was hard for me. And now I feel like I'm also now giving, like, I'm like that student who's just kind of everything was
because we think out loud. And I think yes, it is very, very much tuning into the other person's meandering thoughts. If I were really doing this, and we had unlimited time, which we don't have, I would now ask you what you want to, like, why you came to the workshop today and what you wanted to improve in your feedback giving. But I'm going to skip that step, just to be able to share what I observed before time runs out, so that everybody else who's really the experts can share also. But I agree with you that the interaction between you and the student, the tone was set by the student, and who gave you a lot of emotional content, and that's kind of what I observed about the interaction. You were very warm and empathic, but I think there was an opportunity to give him more concrete feedback, to like show that he was heard, but to say, here, I want you to be able to calibrate your self-assessment better. So tell me 2 things that you think went well, right? To sort of guide him a little bit more concretely. I'm so grateful I get the observer role. It's the easiest role going. Just FYI. But there was a lot of focus on the feelings, but then I wasn't sure how that connected to the skills that he needs to actually feel better. I thought that, that was the biggest thing. I also thought that he was giving an interesting point to consider for medical student training, which is, how do you communicate authentically and empathically when you have absolutely no clinical idea what's going on? That's not an unimportant skill in life, right? I mean, most of the time we're going to be hit with patients where we actually have absolutely no idea what might be going on, and we still have to be reassuring and empathic, and we have to make a plan to follow up and how you're going to get the information. I thought the student did that. Okay, I'm going to get my resident doctor right away, So I think there were some opportunities to focus on his strengths and to help him calibrate his self-assessment and acknowledge the feelings, but then connect them to an action plan.
I want to say that is probably the most thoughtful feedback we've had from an observer. So I really appreciate that. That was a lot of really good points. And Dr. Cho, you did a great job at utilizing and trying to apply the formative feedback model there. So continue practicing and using that. It was great. Meta, do you mind going to the next slide? I just want to make sure we wrap up. Keep going. So again, the takeaways for today, use this model, try to begin applying it in any setting that you're in, anytime you interact with the student, and really be open to stopping and listening to that student self-assessment. I think you'll hear a lot of insights about their own experiences, where they're coming from, that allow you to give feedback that's going to have a bigger impact on them. It's going to be critical to make sure you treat it as a conversation. So again, start trying to practice and taking this. The more you use this model, the better, the more natural it will come. But it really opens you up to trying to be thoughtful and leave the student with a plan to get better, and make sure you follow up on that. So there are a couple of resources. Our faculty development website, we have a couple of resources up there. And then the instructional and curricular design website has additional resources for elective leads on there as well. So if you have any questions on how to access that, Teresa Della Vecchia, who is on the meeting, is going to be the great point of contact. They're updating a lot of it to get additional resources put up there for you as elective.
And we're going to share all of this with you through the email so that you can also share it with your faculty.
Correct. Thank you, Meta. Again, just a reminder, the contact information, you have that. We have a couple webinars upcoming. So please join us again. And lastly, I know we have a minute left here, the CME link. Meta, do you mind just going to that slide? Make sure you please fill out the survey. You can either scan the QR code, Meta put the link in the chat, and she'll also be emailing out the link with all of the materials from today. Please fill it out. That way you're able to get your CME credit for joining us, as well as provide us with valuable feedback to go through and make improvements on our sessions as we move forward. With the time that we have left, any questions, any feedback that you'd like to share right now?
And I just want to add into Dr. Lippman's feedback into the feedback. And you actually use the photo with feedback to give feedback, which we were so happy about that. It
I
means
tried.
Yes.
I actually had a question though. I noticed that Christina asked the student, you know, what helped him on other rotations, and he gave some useful information. I've had like mixed, and not in a student context, but in giving feedback in other contexts, I've had mixed results trying to get the student to connect to other prior experiences. Any pearls on that?
I mean, asking the question, I think, is critical because, again, you know, there's actually a cognitive theorist guy by the name of Epstein that said, I can knock anybody back to being a med student by bringing them into a knowledge area that they know nothing about. And knowledge is king in terms of all of the other stuff. So this could be, I could push an accomplished attending into a very uncomfortable situation when they don't have knowledge. And asking the question and making people realize that they need that framework and foundational knowledge in order to be able to feel like they're comfortable is really, really critical. So I think just asking the question is 3/4 of it. You know, why didn't you have a differential? To the student, why, you know, you've used it before. Why didn't you have a differential? Walking into that room, you could have done the same thing. You know, Dynamed Plus, you know, what's the differential for, you know, fluid, you know, passing a lot of fluid, and it would have given you a bunch of other things to think about.
So there's a knowledge deficit I had about how important that was. So I clued in on Christina, some other aspects of your interaction instead, and that was a missed opportunity for me to give you positive feedback that like you connected it in that way, because I didn't know that whole Epstein thing. So if that's his name. So interesting. Okay, good learning for me.
Thank you. Sorry about the, my awkwardness as an actress. It just
most people hate role plays. I do a lot of role plays.
You did a great job. It wasn't awkward at all.
It is, but that's one of my personal objectives, is to kind of be able to take more from some of these by feeling more comfortable, I think, in that.
The first thing one of the courses I took years ago for my master's in education, the very first thing they did in the courses, they threw us all into the lab, into the video lab, and put you into role play. And the most amazing way to learn is to watch yourself on the video. It's like, I do that? that's me. But that was
It
fun.
sounds amazing and horrible at the same time.
Yeah, no, but it's fun. It's really fun. And by the way, this was videotaped, so you can go back and look, Christina.
All right, with that, I think we're all set. I appreciate it. Thank you so much.
Thank you,
Thank
everyone.
you.
Stay.
Thanks so much.
Bye.
Maddie, you're all set to do an observation tomorrow?
Yes.
Excellent. Very good. Thank you so much. That was great. Great job, Joe, as always.
Thank you.